Anesthesia is one of the most cornerstones of modern medicine, allowing doctors to perform complex and painful procedures safely and humanely. It creates a reversible state of unconsciousness or loss of sensation. The anesthetist's art lies in balancing various drugs and gases to achieve pain relief, memory suppression, muscle relaxation, and control of awareness, while keeping vital organs functioning normally. This delicate balance is what transforms anesthesia into both a science and an art form. The ultimate goal is patient safety and comfort, ensuring the procedure proceeds smoothly without distress. Understanding anesthesia begins with appreciating how it interacts with the nervous system, temporarily silencing pain pathways and reflex responses. Beyond the operating theater, anesthesia extends into intensive care, pain management, and emergency medicine. Its precision reflects collaboration between clinicians, pharmacologists, and biomedical engineers. Together, these fields ensure that anesthesia remains reliable, adaptable, and safe for every patient, marking one of medicine's greatest advances. Anesthesia refers to the controlled temporary loss of sensation or awareness, achieved through medications or gases. It's not simply sleep, it's a carefully induced physiological state where consciousness, movement, and pain responses are suppressed. The aim is to make medical intervention safe, painless, and controlled. During anesthesia, clinicians maintain a balance of four key goals: analgesia, pain relief; amnesia, no memory; muscle relaxation; and control of the body's autonomic responses. This balance demands constant vigilance, as even small variations in drug levels can affect the cardiovascular or respiratory systems. Pre-operative assessment identifies patient risks. Intraoperative management maintains homeostasis, and post-operative care ensures safe recovery. Modern anesthetists also use advanced monitoring, EEG, BIS, and capnography to guide precision. Through this combination of art, technology, and pharmacology, anesthesia turns surgery from a painful ordeal into a controlled therapeutic process that protects both body and mind. The history of anesthesia. The history of anesthesia is the story of humanity's determination to conquer pain. Before the 1840s, surgery was brutal and traumatic, often performed without any means of pain control. In 1846, dentist William Morton publicly demonstrated the use of ether for surgical anesthesia in Boston, marking a medical revolution. Soon after, chloroform gained popularity thanks to James Young Simpson, particularly in childbirth. These early agents transformed surgery into a more humane science, though they carried significant risk like respiratory depression and toxicity. Through the 20th century, anesthesia chemistry evolved, introducing halothane, isoflurane, and sevoflurane, each offering better control and safety. Intravenous agents such as thiopental and propofol revolutionized induction and maintenance. Meanwhile, biomedical innovations like vaporizers, gas scavenging systems, and electronic monitoring turned anesthesia from a guessing art into a measurable process. Today's precision owes its roots to these pioneering discoveries, each step improving patient safety and expanding surgical possibility. Anesthesia unfolds through four classic stages that describe how the central nervous system responds to increasing drug concentration. The first stage, analgesia, is marked by consciousness with diminishing pain sensation. The second, known as excitement or delirium, brings irregular breathing, and involuntary movement as the brain transitions deeper. Stage 3, surgical anesthesia, is the therapeutic target. Reflexes disappear, breathing becomes regular, and muscles relax. Stage 4, or medullary paralysis, is overdose territory where breathing stops and cardiac arrest may occur. Anesthetists use these physiological landmarks to guide safe drug titration, keeping patients precisely within the desired depth. Understanding these stages is critical for both clinicians and biomedical engineers, as modern machines are designed to support each transition safely. Effective monitoring using EEG, capnography, and gas analysis helps prevent dangerous shifts and ensure stable surgical conditions throughout the procedure. Anesthesia is tailored to each patient and procedure. The three principal types are general, regional, and local. General anesthesia induces complete unconsciousness, typically for major or long surgeries. Regional anesthesia numbs specific nerve groups as seen with spinal or epidural blocks used in obstetrics or orthopedics. Local anesthesia affects a small area for minor procedures like dental work. Sedation sits between wakefulness and general anesthesia, calming the patient without full loss of consciousness. The selection depends on surgical site, duration, patient comorbidities, and personal comfort. Combining techniques such as local blocks with light sedation can reduce drug requirements and enhance safety. Engineers contribute by ensuring delivery systems, ventilators, and monitors perform consistently. Whether it's numbing a fingertip or rendering the body fully insensible, every anesthetic plan centers on precision, safety, and rapid recovery. Anesthetic agents interrupt nerve transmission and alter brain activity to block pain and awareness. Inhalational agents like sevoflurane or isoflurane deliver controllable depth through vapor systems. Intravenous drugs such as propofol, ketamine, or etomidate act rapidly and are often used for induction. Muscle relaxants like rocuronium or sacchinylcholine provide controlled paralysis for airway management and surgical precisions. Adjuncts, opioids, benzodiazepines, and antiemetics maintain stability and comfort. Each drug's kinetics, onset, duration, and clearance must be precisely matched to a patient physiology. Biomedical systems such as vaporizers and syringe pumps translate these pharmacological decisions into mechanical accuracy. Understanding these dynamics ensures safe, repeatable results, making anesthesia a precise collaboration between chemistry, computing, and clinical skill. Monitoring the depth of anesthesia is essential to ensure adequate unconsciousness without overdose. The bispectral index monitor reads brain electrical activity and translates it into a scale from 0 to 100. Surgical anesthesia lies between 40 and 60. This technology complements clinical observation, heart rate, blood pressure, and reflexes to prevent accidental awareness or excessive drug depth. In addition to BIS, capnography and pulse oximetry provide real-time ventilation and oxygenation rate. Engineers plays a key role here, integrating multi-parameter monitoring systems that display trends and alarms. As automation advances, closed-loop anesthesia systems adjust drug infusions based on sensor feedback. This harmony between clinician and machine exemplifies the evolution of anesthesia into a digital, data-driven science focused on precision and safety. Airway control is the single most critical aspect of anesthesia. Once muscle relaxants are administered, the patient loses the ability to breathe independently. Anesthetists secure the airway using an endotracheal tube or laryngeal mask and maintain ventilation through mechanical ventilators. Capnography verifies correct tube placement and adequate gas exchange by measuring exhaled CO2. Pulse oximetry continually tracks oxygen saturation, while pressure and volume sensors ensure lungs are neither over nor underinflated. Engineers ensure these devices remain calibrated, responsive, and fail-safe. Modern ventilators now feature adaptive algorithms that adjust breathing support to the patient physiology. Airway management truly represents the intersection of clinical expertise and engineering reliability, the patient's lifeline under anesthesia. The recovery or emergence phase begins when anesthetic agents are discontinued and normal function gradually returns. Reversal of muscle relaxants restores spontaneous breathing. Patients transition through varying levels of consciousness monitored for airway stability, circulation, and temperature. The post-anesthesia care unit, PACU, is equipped with dedicated monitoring for this early risk: nausea, airway obstruction, or blood pressure fluctuations. Biomedical systems assist by providing continuous readouts and alarms, ensuring issues are addressed before discharge. Recovery isn't merely waking up, it's the reactivation of protective reflexes and physiological equilibrium. Team coordination, supported by reliable technology, guarantees patients emerge safely and comfortably from anesthesia, ready for post-operative care or discharge. Anesthesia represents the fusion of medical science and engineering precision. It enables surgeons to perform life-saving operations while maintaining patient safety and dignity. Every anesthetic involves careful drug selection, continuous monitoring, and seamless teamwork. The key takeaway is that anesthesia is not just a clinical act, it's a dynamic system built on technology, physiology, and human judgment. Understanding its principles helps engineers design better equipment and clinicians deliver safer care. Together, they create a controlled environment where pain is eliminated, functions preserved, and recovery ensured. This discipline's evolution from effort to electronic monitoring is a testament to how human ingenuity continues to transform medicine for the better.